Good afternoon po, Doc.
Thank you, Doc.
Can you see now my slide?
Yes, po, Doc.
Doc.
Okay, thank you. So for this afternoon, I will be talking about endocrine histology, specifically pituitary, adrenals, thyroid, and parathyroid. Okay. So at the end of the lecture, the student shall understand the histology of pituitary and adrenal glands with clinical correlation. So there are specific aims that we need to answer before we start with the proper histology of the pituitary, adrenals, thyroid, and parathyroids. Okay. So number one specific aim is that we need to define glands. Okay. So what are glands? So if you look at this structure, this comprises a good picture of a gland. Okay. So a gland must have two components. Okay, the secretory portion and the excretory portion, or the secretory tubular component or glands and the excretory ducts. Okay, because every glands kailangan meron siyang product. Okay, so the product is made by the secretory tubular glands. Okay, then after secretion of that product, it must be excreted to the parts where it is needed. Okay, so therefore a gland must have an excretory portion and a secretory portion. So when we say gland, this is a collection of cells or organs responsible for secretions and excretions. Okay? So hindi yan gland kung secretion lang. Hindi pwede kailangan excrete yan. So it must have the capacity to secrete and excrete. Okay? So next specific objective is we must have to differentiate endocrine from exocrine glands and give examples of each. Okay. So I made here a tabulation so that it will be easier for us to define and to differentiate endocrine from exocrine glands. Okay, so in that table, in this portion, we have the endocrine, and the other portion is the exocrine. So ducts, do they have ducts? Okay, I'm sorry. Yes, okay. So the ducts are very prominent in the exocrine glands, whereas in the endocrine, they don't have ducts. They are ductless. Okay. How about blood supply? Yes, dito marami kang ducts, dito naman marami kang blood supply. Because they don't have ducts, they give their secretion to the blood. Okay. So hormones, how about hormones? So hormones are special products produced by endocrine glands. Okay, so the products produced by the endocrine glands are called hormones. Whereas exocrine glands, it does not mean na wala silang products, or else they will not be qualified as glands. Okay, kaya lang they have products but the name is not a hormone. No, it can be a serous secretion, it can be a mucinous secretion, or it is a sweat or a perspiration. These are products of the different glands, but they are not hormones. Okay? Okay. How about exocrine? This is to differentiate exocrine from endocrine secretion. Okay, as I have said kanina, the endocrine has no ducts, or they are ductless glands, but they have the means of excretion of their products is through the blood vessels. So a part of that secretion will go with the flow to the blood. Okay, whereas exocrine glands, they are divided into three types. Okay, we have the merocrine. It's just a pinch or a portion of secretion is given, okay, to the ducts. Whereas apocrine, a part of it is given. Whereas a holocrine, the whole thing is given. Kaya holo means whole. Okay? So, in the endocrine gland, I have mentioned that the secretions or the products or the hormones are released into the blood vessels. Okay? It's not easy as that. No, hindi lang na ilalagay lang nila ang hormones nila tapos na yan. So, there are what we call specific receptor. There are messengers and receptors. Okay. So, for example, this is the secreting cell or the endocrine gland. So, their products will be delivered to the blood. So, that product, kailangan mayroon siyang chemical messenger na magdadala kung saan siya kailangan. So, for example, kailangan na siya ng thyroid gland. Okay. So, from pituitary, kailangan siyang madala patungong thyroid gland. So, through the blood, no? So, hindi yan makakapunta doon sa thyroid gland kung wala siyang chemical messenger. Okay. And that chemical messenger is very specific for that hormone. Okay. So, it will be carried on. So, once na nandun na yan, ready for release to that organ needed or kung saang part man siya needed, kailangan may target receptor yan or specific receptor. Okay? So, hindi din yan makaka-attach doon, hindi rin magagamit ang function niya kung hindi specific ang receptor. So, this is what we call a secreting target and specific receptor. So, hindi lang ilalagay lang nila sa blood tapos na, no? So, kailangan may specific yan. Mayroong yang target receptors or specific receptors that they have to attach in order for them to become functional. Okay? So the problem is if may mga pasaway na mga hormones na hindi mag-attach sa specific receptor. If they will attach to a wrong receptor, then a pathology will come in pag hindi tama ang kanilang attachment or specific receptors. Okay? And the third specific aims is to give the types of endocrine glands. So what are the types of endocrine secretion? There are 3 types, no? The endocrine, meaning the hormone is distributed in the blood and binds to distant target cells. So for example, this is the hormone, it will be delivered into the blood by the endocrine. For paracrine, the hormone acts locally by diffusing from its source target cells in the neighborhood. No? So, if this is the producing cell or the secreting cell, it will act to the nearby. Kaya para means near, no? Paracrine. When auto means self, the hormone acts on the same cell that produced it. Okay, this is the autocrine. So, sarili lang niya. There are 3 types of endocrine secretion. The endocrine, meaning from the blood, from the production of the cell to the target organ, paracrine, and autocrine. Okay, so these are the different endocrine glands of the body. No? Number 1 is hypothalamus. Number 2 is pituitary gland. Number 3 is thyroid gland. Number 4 is thymus. Number 5 is adrenal gland. Number 6 is These are kidneys, no? Kidneys, and this is number 7 is ovary. Number 8 is testes. Number 6 is pancreas. Okay? But as you can see, we will only tackle my topic for pituitary gland, thyroid gland, and the parathyroid gland, adrenal gland, and adrenal glands. Okay, so the rest of the endocrine glands will be tackled when we go to the specific organ. So, for example, in the male reproductive, okay, when you go to male reproductive, the testes will be tackled. When we go to the female reproductive, the ovaries will be tackled. Okay, so what are the types of endocrine secretions? No, so we know that endocrine is a type of gland, endocrine gland, wherein the products are released into the blood, then to the target organ. Okay? So what are the types of endocrine secretions? So there are pure endocrine, meaning they are dedicated to produce hormones. And the examples are the pituitary, the thyroid, parathyroid, hypothalamus, and adrenals. So I will be talking in my lecture only the pure endocrine. Okay? How about the mixed endocrine? So there are also mixed endocrine, meaning endocrine component in clusters in organs having mixed functions. So they are the organs na hindi lang endocrine, may other functions pa sila. Just like, okay, sample are the pancreas, thymus, ovaries, testes, and liver. So these are mixed, okay, endocrine glands. Okay. For the diffuse endocrine glands, they're comprising scattered cells within organs acting locally in adjacent cells without entry into the bloodstream. So para silang paracrine gland. So ang examples niyan are the apud, no? These are the amine precursor derivatives, okay? These are your enteroendocrine cells of your gastrointestinal tract. So these are seen in your, mostly in the gastrointestinal tract, okay? And plus kidneys, no? There are also other organs na mayroong endocrine component, no? Just like kidneys, no? Kidneys are also an endocrine, it has an endocrine function because it produces your erythropoietin and renin. And your heart, no? Do you know that your heart also has an endocrine component? Nowadays, bago lang ito, no? Because it was discovered that it can produce an ANP or BNP. These are your atrial natriuretic peptide and the BNP, no? So, bago lang siya. Next, the lungs, no? You know that lungs also has endocrine component, no? That's why may mga endocrine tumors present in the lungs. Okay, placenta, no? Placenta is not only for the house, no, of the fetus, but also they serve also as hormone production in some conditions. Okay. Next, let's go to the hormones. Okay. So you know in your physiology that hormones are controlled by negative feedback. So I hope and I assume that you already know the concept of negative feedback mechanism. And take note that hormones are not secreted at constant rate, no? So it depends upon, no? Mayroong pulsation, mayroong may mataas minsan may kaunti lang. So they are not secreted at a constant rate. And they are regulated by, number one, humoral, meaning the action of a substance other than a hormone on an endocrine gland. So there are hormones also that control other hormones. So for example, the glucose, no? The level of glucose can influence the level of insulin. So that's a humoral regulation. Another is nervous regulation, meaning the sympathetic division of autonomic nervous system also can help regulation. Samples are epinephrine and norepinephrine during stress level. Okay? And hormonal regulation. So the control of one endocrine gland by hormone secreted by another endocrine gland. Okay? So TSH is produced in your pituitary gland, which actually regulate or control your T3 and T4, which are produced in your thyroid gland. Okay, so these are the different regulatories of your hormone. Okay, so let's look at the case of Selena. Okay, so Selena is an 18-year-old female. Noticed when she was 6 years old, she is 5 times taller than the girls in her age. She can also sleep for longer period of times, up to 20 hours. A blood examination showed elevated blood sugar and growth hormones. So cranial CT scan show an important finding. So later on, we will know what happens to Selena and where is the problem. Okay? So this is the CT scan showed in this patient. So later on, we will know what happens to Selena. Okay. So we have here a pituitary gland. Okay. So the pituitary gland is a part of your hypothalamus. Okay. So anatomically and histologically, it is divided into anterior and posterior pituitary. The posterior pituitary is more considered to be a more part of your hypothalamus. Okay? Your anterior pituitary in histology is known as adenohypophysis, whereas your posterior pituitary is called a neurohypophysis. It's called adeno because if you look at the structure in the anterior, it's different from your posterior. Ito may pagka-glandular, kaya adeno. Ito naman may pagka-neural, kaya neuro. It is true because your posterior pituitary is part of your hypothalamus. So that's why may pagka-neural ang component dito. Okay? So, the anterior pituitary or the adenohypophysis has 3 pars. So when we say par, these are 3 parts or histologic divisions. Okay, so what are the 3 pars? We have the pars tuberalis, the upper part. We have the pars distalis and the pars intermedia. Okay? So the adenohypophysis has 3 parts. We have the pars tuberalis. We have the pars distalis. Okay. The pars tuberalis is a collar of tissue that usually surrounds the infundibular stalk. So, the upper part. Okay? Whereas the pars distalis is the largest section or the largest part of your adenohypophysis. Actually, your adenohypophysis is 80 to 90% pars distalis. Okay? Whereas your pars intermedia is this part separates distalis from nervosa. Okay? So, your neurohypophysis or posterior lobe is also known as pars nervosa. Okay, so this is the histologic part of your pituitary gland. Okay, so this is the hypothalamus. This is the posterior or the neurohypophysis or the pars nervosa, whereas this is the pars or this is the adenohypophysis or the anterior pituitary, in which we have the pars distalis, pars tuberalis, and pars intermedia. Okay. So what are the cells present in the anterior pituitary gland? Okay. So there are 2 types of cells present. Okay. We have the chromophobes, 50%, and the chromophils, 50%. Chromophils are divided into 2. The basophilic cells, which corresponds 10%, and the acidophilic cells, which is 40%. Okay? So 50-50 yan. Okay. While the chromophobes, meaning they don't take up, wala silang color, kaya chromophobes 50%. Ang may color na mga cells are called chromophils, which is divided into 2, the basophilic cells and the acidophilic cells. Okay. So what are the acidophilic cells? The acidophilic cells, dalawa lang, madali lang maintindihan, no? GP, growth hormones and prolactin. Whereas the basophilic cells are the rest, no? The corticotropes, gonadotropes, and the thyrotropes. Okay. So the pink one, the pink cells are your acidophilic. Okay. The blue cells or the purple cells are your basophilic cells. Okay, these are basophilic cells or the basophils. Whereas the white cells o hindi nag-take up ng mga cells, these are your chromophobe cells. Okay. So given this picture, no, hindi natin for example, pink cell. Remember your acidophilic cell, hindi mo malalaman kung growth hormone ito or prolactin. Kasi parehas ang growth hormone and prolactin, they will appear as pink. So ordinary staining. So ordinary staining man lang ito, no? So pag sinabi mong acidophilic, pag itong ipinakita sa iyo, so hindi tayo sure kung growth hormone yan or prolactin. So we need to do a special staining para malaman mo siya kung growth hormone yan or prolactin na cells. Do you get? Do you get what I mean? Okay. So same also is in the basophilic cells. Okay? Di ba basophil yan? Basophil, basophil. So remember, there are 3 types of basophilic cells. The corticotropes, gonadotropes, and thyrotropes. Again, we don't know kung ano ang mga yan. So they are generally called basophilic cells. In order for us to know the specific types of cells, we need to do special staining. Okay. So these acidophilics are also polypeptide. So polypeptide hormones in their chemical nature. Whereas the basophilic cells or the basophilic hormones are glycoproteins in nature. Okay. So all anterior pituitary hormones except prolactin is stimulated by delivery of releasing hormones. Okay. And prolactin is stimulated by PRH, and this is inhibited by dopamine. Okay. So closer view, again, these are the basophilic cells, basophilic, acidophilic cells, and these are your chromophobe cells. Chromophobe. Okay. Another picture, no? So the pink one are acidophilic, more of acidophilic. Okay. This is chromophobe. Okay. So aside from the cells present in the anterior pituitary gland and the different divisions, the pituitary gland is also consists of many blood vessels, no? Maraming blood vessels doon. So we know why. Because they are endocrine glands, okay? They will release their hormones to the blood. So kailangan marami silang background na blood vessels. Okay? And they have delicate connective tissue framework, no? So may mga connective tissue framework as the kumbaga house ng mga cells, and they have a connective tissue capsule. Okay. So as a summary, no, we have the anterior pituitary gland. So anterior pituitary gland, as I have said, is known as adenohypophysis. There are 3 pars, the pars tuberalis, the pars distalis, and the pars intermedia. Okay. So the anterior pituitary gland produces these hormones, no? The growth hormone, prolactin, ACTH, TSH, FSH, and LH. There's only one hormone produced in the intermediate or the pars intermedia, the melanocyte stimulating hormone. Okay. Whereas in the posterior, closer view of the pars intermedia. Okay. So the pars intermedia is rudimentary in humans. So in histological aspects, sometimes they are not seen. No, it's quite difficult to look at if there is a presence of pars intermedia. Minsan nawawala ito as the patients get old. Okay, and if this is present, the only landmark, histologic landmark that we know that this is a pars intermedia is the presence of colloid filled cysts. No? So may mga cystic structure yan, and they are filled with colloid materials. Okay, and they are filled with colloid materials. So this is the histologic component of your pars intermedia, which is a part of your anterior pituitary gland. Okay, so how about in the posterior? In the posterior aspect. So what are the hormones produced? Ano ang hormones na napoproduce dito? Any answer from the group? Any volunteer?
ADH.
ADH? Ano pa?
Oxytocin.
Oxytocin. Okay. I'm sorry. Pero, before we go to that, ito ang problem pala kanina ng patient natin, no? Ito ang patient natin kanina, si Selena, na bakit siya nagkakaganito? Okay. Bakit siya mataas masyado based on age? Tapos sa mga classmates niya, sa mga relatives niya and friends, bakit siya ganyan? No? Then bakit din lagi siyang tulog, na mahilig matulog, mataas ang growth hormone, mataas ang sugar. So may problem ang kanyang anterior pituitary gland. And may also affected ang kanyang growth hormone. Okay? So, back to the question, I'm sorry that there are no hormones produced in the posterior pituitary gland. No? Walang hormones na po-produce in the posterior pituitary gland. Please take note with that. They are not stored. The ADH and the oxytocin are only stored. They are not produced in the posterior pituitary gland. Okay? So, in the neurohypophysis or the pars nervosa, walang hormone na napoproduce. Okay? The antidiuretic hormone and oxytocin are produced in the hypothalamus. The ADH is produced from the supraoptic hypothalamus, while your oxytocin is produced from the paraventricular hypothalamus. Okay. So after production in the hypothalamus, di ba magkakabit ang posterior pituitary mo and the hypothalamus? Okay. So once they are produced there, dinadala sila patungo sa posterior pituitary for storage. So kung kailangan na sila. Okay? So this is an antidiuretic hormone needed for the kidney, and oxytocin is for the contraction, no, uterine contraction and milk let down. So kung kailangan na sila, yun lang sila nire-release ng posterior pituitary gland. Again, there are no hormones produced in the posterior pituitary gland. They are just stored there. Okay. So ano naman ang histologic component ng posterior pituitary gland? Okay. There are what we call pituicytes. The cells present in the posterior pituitary gland are pituicytes. Okay, mga pituicytes ang tawag sa kanila. Siyempre, marami ding blood vessels in the form of capillaries. And there are neural component called the neuropil, and there are hearing bodies present in the posterior pituitary gland. Okay, the hearing bodies are the storage sites of the neurosecretory structures of the pars nervosa neuron. So dito nakatago ang mga hormones na kailangan later on. Okay? Whereas the pituicytes are the main cells and the neuropil are the dense network of nerve fibers, branches, synapses, and glial elements. So that's why your posterior pituitary gland is called the nervous part. or the pars nervosa or the neurohypophysis. Okay, so the summary, this is the summary of a pituitary gland. Okay, this is also known as adenohypophysis. This is also known as neurohypophysis or pars nervosa, showing you the different hormones present in the portion of your pituitary gland. Okay? So, na-answer na natin si Selena kanina, no? So, may problem siya sa anterior pituitary gland, may tumor in the pituitary gland, and that tumor produces a lot of growth hormone. No? Kaya matangkad siya masyado. It's a case of gigantism. Okay. Now, let us meet Sulin. Sulin is a 35 years old. Meron siyang uncontrollable blood pressure. So whatever will be given, no, na anti-hypertensive, hindi pa rin nakokontrol ang kanyang blood pressure. So what is the diagnosis of Sulin and where is the problem? Okay, let's go to the adrenal gland. So adrenal gland is a part of the kidney. So they are also known as the suprarenal gland. Supra because they're above. No, they are above the kidney. Suprarenal gland. Histologically, the adrenal gland is divided into cortex and medulla. Okay? So, there are three zones of adrenal gland. GFR. GFR. Okay? So, this is the capsule and this is the medulla. For the cortex, as you can see, they are called different zones. No? Malalaman natin glomerulosa because they look like glomerulus. No, the structure. Fasciculata kasi elongated sila. Mga fasciculated. Whereas reticularis reticulated. And ito naman ang medulla. Okay? So this is the actual histology of your adrenal cortex. So they are divided into three zones. The glomerulosa, fasciculata, and the reticularis. For the glomerulosa, based on the pattern, no? Kaya tinawag silang glomerulosa. While fasciculata, fasciculate. Whereas reticularis, ganito ang mga itsura ng mga cells nila. Take note, even though there are different zones, okay, there are different zones, the boundaries between zones are indistinct. So, hindi masyado klaro ang division. Malalaman lang natin ang morphology ng component of each. Okay? So the zona glomerulosa is the narrow, outer, the most outer and the most the external layer, which constitute about 15%, whereas the zona fasciculata is the thickest layer, the middle part, constituting about 80%, and reticularis is the inner zone. Okay, the inner zone, which constitute about 5%. Okay, so glomerulosa. So there are small columnar cells arranged in closely packed ovoid clusters and curved columns. They have spherical nuclei and appears closely packed and stained densely. And they have a lot of capillaries or blood vessels. Okay, so this zone produces your mineralocorticoids. No, these are your aldosterone and the oxycorticosterone, but mostly aldosterone. They maintain the fluid and electrolyte balance. Whereas your fasciculata, they are large polyhedral cells arranged in the long straight cords. Okay? And they have a lightly staining spherical nucleus, and they have binucleate cells are common. And they have numerous lipid droplets. Kaya if you look at the cells, parang clear because they have a lot of lipid droplets. So this zone produces glucocorticoids. So your cortisol and corticosterone. Okay? So they regulate the metabolism of your carbohydrate, protein, and lipid, and they suppress your inflammation and immune response, and they impair the healing process. Okay? Whereas the zona reticularis, they are made up of dark acidophilic cells, And they have abundant lipofuscin pigment granules, kaya dark sila masyado. So they are called reticularis because they're arranged in anastomosing cords. Okay? And they have few lipid droplets. Okay? And they secretes androgens, specifically your dihydroepiandrosterone. And they have weak masculinizing effect and libido body hair for the female. Okay? So for the adrenal cortex, always remember the S3. So the salt, the sugar, and the sex. So the deeper is sweeter. So, yan, mnemonic natin, no, for the hormones produced in the adrenal cortex. Okay? How about adrenal medulla? So the most important cells in the adrenal medulla are the chromaffin cells. Okay? They're the most abundant cells. And they have connective tissue, sinusoidal blood capillaries, and your medulla is may pagka-neural component. Okay? Kaya marami siyang nerves and sympathetic ganglion cells. Okay. So the chromaffin cells are also known as pheochromocytes. They have large pale staining epithelioid cells organized in clusters, ovoid clusters, and short interconnecting cords. An intimate relation with blood capillaries. And the cytoplasm are granular. Okay. So these chromaffin cells produces adrenaline, the catecholamines, no? The epinephrine and the norepinephrine. They augment sympathetic activity and they have a major role in acute response to stress. Okay? Whereas the adrenal medulla also in the innermost part contains the central vein. Mayroon siyang malaking vein in the medulla, no? The abundance arrangement of, there are also abundant presence here of smooth muscles in the wall, in the central vein of your medulla. Okay? So the summary of your adrenal cortex and adrenal medulla. The adrenal cortex is, the adrenal gland is capsulated, histologically divided into cortex and medulla, and it has 3 zones. The cortex has 3 zones, glomerulosa, fasciculata, and reticularis. So glomerulosa produces mineralocorticoids, fasciculata glucocorticoids, and the reticularis the androgens, the S3, the salt, ano pang S3 natin? The salt, sugar, and the sex, no? Ito, the salt, the sugar, and the sex. And medulla produces the catecholamines, epinephrine, and norepinephrine. Then if we'll go back to Celine, a 35-year-old, during the workup, mayroon siyang adrenal mass. So the adrenal mass is located in the adrenal medulla. Okay? So remember, your adrenal medulla is may pagka-neural and it produces a catecholamines, no? And epinephrine and norepinephrine. So that's why, because of the tumor present in the adrenal medulla, palaging mataas ang kanyang blood pressure. Hindi nawawala kahit mag-take siya ng antihypertensive because of pheochromocytoma. Okay? So, as a summary, this is an adrenal medulla. This is the zona glomerulosa. This is zona fasciculata, zona reticularis. The whole thing is the cortex, and this one is adrenal medulla. Okay, so you can see here the pheochromocytes or the chromaffin cells, and in the middle part you can see the central vein. Okay, so any questions, guys? Any questions? So I think none. So I think I need to continue. Meron pa akong 15 minutes para matapos na tayo, no? Kaunti lang ang thyroid and parathyroid. Sorry.